Hi, everyone. We are Group C, and our policy is the Family Smoking and Prevention Act.
And the problem we are focusing on is targeted tobacco marketing to marginalized populations, especially towards younger populations. And advertising can be focused on different socioeconomic communities, and this is usually done geographically. Advertisements around low-income school areas can be targeted towards young kids and teenagers by advertising vapes and other attractive tobacco products. The advertising market focuses a lot on the youth, as addiction is an easy habit while developing throughout your youth. Tobacco products are too easy and accessible for the youth of today, and it's causing more problems than just cigarette sales. The Federal Trade Commission has stated that in 2018, the tobacco industry spent over $9 billion on advertising alone. And according to countertobacco.org, marketing and advertising of tobacco has been found to encourage youth smoking uptake, which has demonstrated a causal relationship between exposure to tobacco advertisements and youth smoking uptake. Across multiple studies, research has shown that youth more frequently exposed to tobacco promotion are 60% more likely to have tried smoking and 30% more likely to be susceptible to future smoking. It's also increased total cigarette sales, distorted youth perceptions about the availability, use, and popularity of cigarettes, foster positive brand imagery around tobacco products, cued cravings and undermine quit attempts, fuel tobacco-related disparities. And the tobacco industry has a long history of targeted marketing towards low-income and minority populations. Policies must be implemented so we can start to see a decrease in tobacco products purchased within these marginalized communities. Next slide.
For policy solution, the 2009 Family Smoking Prevention and Tobacco Control Act is a federal level policy which is intended to curtail the marketing and sale of tobacco products to minors. Under this act, the FDA acts as the regulatory authority for the manufacturing, distribution, and marketing of tobacco products. Further, this policy revises the nationally standardizes the minimum age at which a young adult may purchase tobacco products to 18 years of age. Other restrictions intended to prevent the sale of tobacco products to minors include banning vending machine sales, flavored cigarettes, the sale of packages containing fewer than 20 cigarettes, promotional giveaways, and advertisement at sports and entertainment venues. The statute is a standalone policy and serves as one of the most comprehensive tobacco regulations to date. While yet to materialize, some regulations, such as the complete ban of flavored cigarettes, the Family Smoking Prevention and Tobacco Act is currently in effect. Implementation of this policy was initiated in 2009 and has been evolving. In May 2016, the FDA finalized a deeming rule, which extends the organization's authority over all tobacco products, not just cigarettes. The FDA has continued to evolve the breadth of this policy and engages international stakeholders in effective means of manufacturing and retail regulation. Next slide, please.
So for our policy landscape, numerous bills have been passed into law or struck down by voters, the Supreme Court, and or other institutions regarding the regulation of tobacco products. The policies that I have provided to the right are the most relevant to this the Family Smoking and Prevention Act. So the first policy that I'm going to address is the FDA v. Brown and Williamson Tobacco Court, which this case happened in 2000. This case ruled that the FDA did not have authority to regulate the tobacco industry. This entire case was overturned by the Family Smoking and Prevention Act. The FDA believed that they had jurisdiction to rule over tobacco industry because tobacco has nicotine and nicotine is considered a drug. But the Supreme Court supported tobacco companies. There's also no publicly available information on how the public leaned towards this Supreme Court case, but the Supreme Court did end up supporting tobacco companies. The second policy is the United States v. Philip Morris, and this happened in 2006. Judge Gladys Kessler ruled that big tobacco companies had lied about advertising to children. She found that big tobacco companies purposely targeted youth in their advertising campaigns. She also found that tobacco companies lied when advertising their cigarettes as low tar, ultra light, or mild. And this court case led to regulations requiring tobacco companies to release marketing data to public website where the government and the public would be able to see the information. This law was supported by the public. So then I'm going to go over our logic model. So Our inputs for this policy to be implemented, one was time. So it would take time to develop the Center for Tobacco Products. It takes time to train the employees and disseminate the information and regulations to the public. It also requires funding to train employees at the Center for Tobacco Products, and specific knowledge it needs to be given out and disseminated to retailers and tobacco manufacturers to learn the new regulations on advertising and marketing. The activities, so first is to educate. We must educate the stakeholders regarding the policy change. This can include tobacco companies and states where smoking is below 18 years old. And we also need to educate the public regarding the policy change. There is a policy change that it is now 18 plus, and there will be stricter ID checking policies. So you need to make sure that the public is aware. And then additionally, we would have to develop a plan for the monitoring and enforcement of the policy. And we would also need to implement penalties for those who do not comply with the regulations provided by the policy. Some outputs include affected parties have been notified of the new regulations. The public has been notified of the new policy, including the change in age restriction and providing proof to verify age. Time was given for the impacted organizations to prepare for policy change, and a plan for monitoring and enforcement is in place. Short-term outcomes, knowledge, one of the short-term outcomes is knowledge of the Family Smoking and Prevention Act is disseminated to the public, tobacco companies, and key stakeholders, and the public perception on cigarette marketing campaigns reflect that belief that it is dangerous to market to children, and it is dangerous to market cigarettes as healthy. Some intermediate outcomes include the decrease in purchasing of tobacco products, decrease in targeted and false advertisement from tobacco companies, and tobacco companies add new warning labels to their products that clearly state the harmful impact of smoking. Some long-term impacts include decrease in adolescent tobacco use, decrease in incidence of tobacco-related diseases, and decrease in healthcare costs related to tobacco-related diseases. So the evaluation questions, the first question is, do tobacco companies abide by the regulations set forth by the Center for Tobacco Products? The second question is, does the limiting of marketing of tobacco products decrease the appeal of smoking to younger individuals? And question 3 is, does regulating tobacco marketing lead to a decrease in incidence of tobacco-related diseases? So our evaluation design, we decided to do a quasi-experimental design just because it is unethical to randomly assign people to smoking groups. And we chose the group comparison pre-post design because we felt that that best fit this policy, because there is data available pre the policy and after the policy. So for our group 1, we thought that we would look at tobacco sales in states with little regulation on tobacco products. This could include maybe having a younger age limit, maybe not strict enforcement on ID checking policies. And then our group 2 is tobacco sales in states with high regulations. This could include an 18 plus requirement and strict ID checking policies. And our control group is sales in states with medium amount of regulations. Maybe they do have an 18 plus, but they're not really strict about checking their policies, stuff like that. And then we would compare the sales prior to the Family Smoking and Prevention Act enactment in 2009 and the sales post. So we figured we would look at sales records from 2006 until 2012.
For the economic evaluation, the type of evaluation to be performed would be a benefits evaluation with a policy cost analysis. This is because if the policy can decrease the smoking rates among the target population, this would be a benefit from the study. This evaluation will be looked at from a government perspective, as the FDA has the authority over the manufacturing, distribution, and marketing of tobacco products within the policy. The cost of the policy would come from educating employees at the Center for Tobacco Products, implementing the policy, which takes a lot of time and resources to develop, plus sharing the information with the public takes time. Teaching retailers and manufacturers the new regulations on advertising will also be an expense of the policy. When measuring our economic evaluation, we need to look at the data we have to compare the sales of tobacco products from those that are under legal smoking age in low income areas and compare them to the rate of the same group once the policy has been implemented. The benefits of this policy will be to decrease sales of tobacco products among the youth and decrease rates of smoking by underage youth. And these are seen through the economic evaluation. Next slide, please.
Data necessary for effective evaluation includes retail and marketing statistics, as well as how many youth have been affected by this policy. According to the FDA's Tobacco Retail Inspection Program from October 2012 through September 2019, the FDA issued 88,000 warning letters regarding compliance violations and administered 23,000 civil monetary penalties to retail establishments. Additionally, in partnership with the Federal Trade Commission, the FDA issued 17 warning letters to manufacturers, distributors, and retailers of e-liquids for misleading labeling, which portrays their products to be kid-friendly and even ingestible because they appear like candy. Both of these steps indicate that tobacco product companies need to cease their tactics toward youth appeal, and these FDA sanctions are purposed to regulate the marketing tactics. Public education is another valuable facet of this policy's implementation. In 2014, the FDA launched the Youth Tobacco Prevention Campaign, entitled The Real Cost. According to a third-party research organization, this resulted in the prevention of up to 587,000 youth ages 11 to 19 from initiating cigarette smoking. As estimated, this equates to $53 billion in healthcare and other societal costs, saving that much, meaning that for every dollar spent toward the Real Cost campaign, there was a return of $180. Next slide, please.
So our first evaluation challenge is that it may be difficult or unethical to find a true comparison/control group, as the policy is working at the federal level and therefore implemented countrywide across all states. We'll not be able to single out one single group or population because everyone would have to comply with this policy. Also, because this is a smoking cessation intervention, there may be a large lag in data collection, and it may be years before we see any statistically significant results. And even when we do get the results, it may be hard to distinguish and single out whether the decrease of tobacco-related diseases is due to our policy implementation alone, or if we are seeing delayed results from a previously implemented policy. Because, next slide, please. Because tobacco industry marketing is one of the major factors that causes a rapid increased spread of tobacco use and tobacco addiction amongst majority communities of color, decreasing the marketing in these areas would inherently decrease the tobacco-related health disparities we see in these communities. Similarly, a lot of advertising is geared towards women through marketing tobacco use as being empowering and providing a sense of independence and social desirability. Many of these campaigns may use urban culture and language to especially promote menthol cigarettes to Black women. So removing the marketing from advertising campaigns would decrease the prevalence of tobacco-related diseases amongst women of color. And one of the main components of this policy is that there will be a stricter enforcement on youth-focused marketing. Statistically, those who are more targeted with ads in general are low-income communities of color. In combating overall marketing, we would expect to see healthier outcomes within these populations, and in turn, the disruption of the current ethnic disparities that currently characterize tobacco use. Next slide. And our question to the class is, in what ways would you improve upon the Family Smoking and Prevention Act in order to reduce young adult smoking rates? Thank you all for listening to the presentation. And here's our works cited list.